health. How do you define the word health? We use the word health all the time. We talk about health care. We talk about health of the mother. But what's the definition of the word health? Well, it was 1973, and the U.S. Supreme Court in a case called Doe versus Bolton actually defined the word health regarding health of the mother and abortion. And Doe versus Bolton defined the word health as physical, emotional, psychological, familial, and age. I mean, the mother, under the definition of the word health, might have depression. She might have anxiety. She might perceive herself as being too young. She might be perceived as being too old. Her mom might not want her to have the baby. The dad might not want her to have the baby. There were no limitations when it came to the word health when it is so broadly defined. So we now have 22 different states which stand up and defend the lives of the preborn, my patients that are in the womb. And they say, well, abortion needs to be available to protect the health of the mother. When abortion is defined that broadly as the health being physical, emotional, psychological, familial, and age. I mean, sadly, there are some conditions where the life of the mother is actually threatened by the pregnancy. An ectopic pregnancy would be one, where the pregnancy is not in the uterus, it might be in the fallopian tube, and it is a threat to the mother's life. But there are other conditions like preeclampsia, severe diabetes, cardiomyopathy, conditions where we need to deliver the baby early. And we have babies that are surviving on the outside as young as 22 and 23 weeks gestation. So the conditions, sometimes they have to be there where we deliver the baby. But it's the delivery of the baby that will improve and protect the life of the mother. It is not killing the baby which will protect the life of the mother, just the delivery. So words matter, words have meanings, and when you look at health of the mother being introduced to legislation and in protest to bring abortion to pro-life states which are standing up for the preborn in the womb, my patients in the womb, the patients in the womb that we now are doing blood transfusions for, open heart surgery, spina bifida correcta surgery, laser vascular surgery, these are patients, and all patients have rights. Words matter, words have meaning. Use these terms carefully and understand the terms that you use, and stand up for my patients that happen to be in the womb of their mothers. God bless you all. If you have any questions, you can contact me through my website, which is Dr. Bill Lyle at prolifedoc.org. I've practiced obstetrics and gynecology over 30 years, and I've delivered over 5,000 babies, and the moms are valuable, and the lives of the babies in the womb, my patients in the womb, also are valuable. Patients have rights. Protect the lives of all patients. God bless you all, and have a wonderful day.